Hi, Kevin Henry, the Group Editorial Director for UBM Medica's Dental Division. And I'm on a Google Hangout today with my friend and the front desk lady, Lisa Marie Spradley. How are you doing today?
Doing great. How are you doing, Kevin?
It is all good. It's always good whenever I get to chat it up with you. So thanks for taking a few minutes.
Thank you. I'm always happy to chat with you too, my friend.
Well, let's talk a little bit about one of the big buzzwords that you're hearing right now out there. I know you are very well connected with the forums and a lot of your clients and things like that. And you and I were talking before we came on the air about you're hearing a lot of buzz about treatment planning right now, right?
I am. I'm actually very surprised. I thought this was something that was being done confidently in practices, just based upon what I'm hearing about, most practices numbers. But recently, when I was speaking, I had several people come to me and tell me that they just weren't sure that who they had presenting the treatment plans was doing it confidently, that they weren't getting enough patients scheduled, and they really wanted to touch on that when I was speaking. So it was very interesting.
So how do you help somebody do things like that more confidently? Because honestly, you know as well as I do, a lot of dentists feel like a salesperson, or somebody in the practice feels like a salesperson where they have to show off these treatment plans.
Well, it's very interesting. Like anything else that we do in the dental practice, we have to have systems in place. And I know that, dental teams cringe when they hear the dreaded words role playing, but it really does work. And what we have to do as office managers, what we need to be doing is making sure that we have the verbiage written down and in place, and that we're training our team on not only what to say, but Kevin, even more importantly, how to say it. Because I can go in and tell someone that they need to have, $10,000 worth of restorative treatment. But if I'm not saying in a way that empathizes with that patient and really pulls, from their own personal experiences, then I'm not going to connect with that patient and they're not going to feel the need to do it. So office managers need to really start stepping it up and training their teams on how to speak to their patients about treatment plans.
You know, that's such a great point because I hear so often that just within a practice, team members are saying different things about the same subject, and it really
Mhm.
confuses the patient so much. They walk out of there going, I don't know who to believe. Is it the assistant who said, I really don't need this? Is it the dentist who said, oh, it's an absolute must? You know,
Mhm.
how do you get everybody on the same page? And I know you cringe at the role playing type of thing, but really that's kind of the office manager's job is to get everybody on the same page, right?
Oh, yes, most definitely. And it has to be something that everybody buys into. So when I go into offices, I always tell the team members what you need to do at your next meeting, you need to gather around the table and pick words that everybody's comfortable with. It's kind of like when you're answering the phone for your dental practice. Maybe some team members, like myself, can't remember whether it's morning or afternoon, so I really shouldn't answer the phone with that particular greeting. Perhaps we can just start with the how may I help you, or how can we make you smile, something like that. And once you have something that everybody buys into, then you practice it. So the office manager needs to facilitate this, but the team needs to really be a part of getting these words down so that when we're sitting down, and this is key too, how you're presenting these treatment plans, are you knee to knee and eye to eye? Don't be standing behind someone or standing over them. That's just intimidating me, you know? And pay attention to what they're saying and make note of it so that you can inform the rest of the team and speak to those fears. There are so many different steps that are involved in this, but honestly, by having these systems in place, the office manager is the one who's really going to make sure that it goes the way it's planned to. Now, are we going to get everyone scheduled? No, but we will get a lot of them scheduled, and we can work on getting permission to follow up with the ones who don't schedule right then.
And I certainly don't want to generalize, but do you find that it's different for younger patients versus older patients? Is there a different way that needs to be communicated, or is it really one of those, if you've got your message, it doesn't matter the age or demographic or anything else?
No, you actually bring up a very interesting fact, because I do believe that maybe not so much age, but just where that person is. I mentioned earlier about, finding out what's going on in that patient's life. I mean, maybe you have someone coming in and their daughter's getting ready to get married. So if you can make note of that, and when you're passing them off, to the financial planner and saying, Mrs. Smith was just telling me that her daughter's going to be married in April. So now all of a sudden I have that key piece of information and I can use that when I'm treatment planning to the patient. So we need to really be paying attention to what's going on in their life. And it can be age specific, but I find it's more life specific. What's happening? Why do you want this treatment right now? And how can we make it affordable for you and get you scheduled just as soon as possible?
Great tips as always. Anything else you want to share, or did we cover it?
Well, we covered a lot of it, Kevin. I think if I shared anything else, I would just say, always remember when you're treatment planning, and a lot of these cases now, when you're talking full mouth restoration, they can be kind of pricey, let's be honest. But you're not just paying for materials, you're paying for the doctor's expertise, and you're paying for, the time that they're going to spend with you. So when you're presenting treatment, take yourself out of it. This is really key. You present that treatment with confidence and knowing that your doctor, your team is worth every penny. I'm really kind of, that internal giggle that Lois Banta talks about. When I have some people come to me and tell me how, they're like, oh my gosh, I can't, it's $30,000. I can't do it. And I'm like, but it's not your position to worry about how much it is. You just go in there and give it your best and tell them why this treatment is going to work for them. So I think that would be my last tip, is have confidence that what you're presenting is really in the best interest of that patient, because I promise you the doctor wouldn't prescribe it if you didn't think it was.
Hey, last tip, first tips, they were all good tips. So thank you so much. And again, Lisa Marie Spradley is the front desk lady, a dear friend, and a former Office Manager of the Year through the American Association of Dental Office Managers. So Lisa Marie, tell our viewers where they can get a hold of you if they want more information.
Probably the easiest way would be on my website, frontdesklady.com. I have a contact me button there that you can press your information in, and I will get back to you quickly.
No surprise at all there. Lisa Marie, I'll look forward to our next chat. Thanks so much.
Thank you, Kevin. Always great seeing you.